Hello and assalamu alaikum. My name is Adnan Iqbal. I welcome all of you. And in this video, we are going to talk about the anatomy of the internal chambers of the heart and the conduction system of the heart. So far, we have discussed about the external features of the heart, and in this video, we are going to talk about the internal features of the heart. And in the internal features, first we will talk about the internal chambers of the heart. So you can see this is the heart, and we have cut the heart and we have removed the anterior portion of the heart, and the surface which you are seeing is the posterior portion of the heart. And in the posterior portion of the heart, you can see we have the different chambers. So this is the right side of the heart and this is the left side of the heart, and you can see the different chambers in the heart. So this is the right atrium, this is the right ventricle, this area is the right ventricle, and this one is the left atrium, and this is the left ventricle. And you can also see the valves. This is the valve between the right atrium and the right ventricle, and that valve which is present between the right atrium and the right ventricle is the tricuspid valve, and this is the bicuspid valve, also known as the mitral valve, which is present between the left atrium and the left ventricle. And you can also see this muscle which is the myocardium. So in this video we are going to talk about the different chambers, these four chambers. We will talk about the special features related to the individual chamber. So first we will talk about the right atrium. This is the right atrium of the heart. The right atrium receives the deoxygenated blood from the body through the superior vena cava and the inferior vena cava. So the right atrium is the receiving chamber for the blood. So this is the right atria of the heart. And if we cut the right atria of the heart from this narrow shallow groove area, then and fold the anterior portion of the right atria in this manner, so you can see the different surface of the right atria anteriorly, and the area from which we have cut down the right atria, that shallow groove area is known as the sulcus terminalis. Externally that area is known as the sulcus terminalis, and interiorly that is known as the crista terminalis. So the importance of the sulcus terminalis and the crista terminalis is that if we cut down the right atria from the sulcus terminalis, this area divides the right atria anteriorly into two surfaces. So you can see this area of the right atria which has the prominent ridges of the smooth muscle, and this another area which has a very smooth surface. These are the two different surfaces of the right atria anteriorly. That prominent ridges of the smooth muscle that are known as the pectinate muscles. These are like the teeth of the comb. So these are the pectinate muscles, and this smooth area is known as the crista terminalis. So externally this area is the sulcus terminalis, and interiorly that area is known as the crista terminalis, because it divides the right atria anteriorly into two different surfaces. So this is the importance of the sulcus terminalis and the crista terminalis. So if we look the right atria posteriorly, we can see different features. There is a depression posteriorly in the right atria. That depression is known as the fossa ovalis. Also, you can see this opening in the right atria, which is known as the opening of the coronary sinus. And you know that the coronary sinus is the largest coronary vein present on the surface of the heart, which drains the deoxygenated blood into the right atria. So this is the opening of the coronary sinus, which is guarded by a valve which is known as the Thebesian valve to prevent the backflow of the blood into the coronary sinus. So the opening of the coronary sinus is there in the right atria. Also you can see the opening of the inferior vena cava, which is also being guarded by the valve which is known as the Eustachian valve. And in the next and the last video I will talk about the arteries and the vein, and in the vein section I will talk about the valves, because all the veins in the body is guarded by the valve. Also on the posterior surface of the right atria we have a very smooth area. That smooth area is known as the sinus of vena cava, also known as the sinus venerum. The importance of the sinus venerum is that the sinus venerum is a very smooth area of the right atria, and it is the area at which the blood from the superior vena cava and the inferior vena cava comes. So at the area of the sinus venerum of the right atria, the blood from the superior vena cava and the inferior vena cava comes from all of the body. So this is the only importance of the sinus venerum, because it is very smooth. So in the right atria, what we have discussed so far, anteriorly we have two different surfaces. These surface is known as the pectinate muscles, and this is known as the crista terminalis. Externally that is known as the sulcus terminalis, and posteriorly we have the fossa ovalis. We have the opening of the coronary sinus, and we also have the opening of the inferior vena cava and the superior vena cava, and the area which is known as the sinus of vena cava or the sinus venerum. And this is the area at which your SA node is present at the junction of the superior vena cava and the right atria. Now let's talk about the right ventricle. So this is the right ventricle of the heart, which receives the blood from the right atria and by this tricuspid valve. So let's talk first about this tricuspid valve, then we will talk about the right ventricle. So this is the, you can see this is the right ventricle. We have isolated the right ventricle, and this is the tricuspid valve, and the tricuspid valve is present at the junction of the right atria and the right ventricle. So why we call it is a tricuspid valve? Because it has three cusps or flaps. So that cusp of the tricuspid valve is known as the septal cusp, because it is present at the septum of the heart, and that cusp is known as the posterior cusp because it is present posteriorly, and that cusp is known as the anterior cusp because it is present anteriorly. So it has three cusps, so therefore that valve is known as a tricuspid valve. So to the cusps of the valve we have the strings or the tendons. That strings or tendons are made up of the connective tissue that are known as the chordae tendineae. So the chordae tendineae are being attached with the cusps, and the job of the chordae tendineae is to attach the cusps of the tricuspid valve with the papillary muscles. So these are the papillary muscles which are present inferiorly to the ventricles. So the cusps of the valve are being attached to these papillary muscles by these chordae tendineae. So if we look at the real human heart, this is a section of the tricuspid valve. So this is the cusps of the tricuspid valve, which is attached to this papillary muscles by these strings which are known as the chordae tendineae. The chordae tendineae attach the cusps of the tricuspid valve with the papillary muscles of the ventricle. You can see this is the right ventricle, and these are the valves which are attached to the papillary muscles by these chordae tendineae. What is the importance of the attachment of the cusp with the papillary muscles. So you know that when the blood from the atria comes into the right ventricle, the valves remain open, so as the blood can easily flow from the right atria into the right ventricle. But when the right ventricle contracts, the right ventricle has to contract to propel the blood from the right ventricle into the pulmonary artery. So when the ventricle contracts, the ventricle contracts inwardly. So when the ventricle contracts, the tensions on this chordae tendineae, the tension on this chordae tendineae loosens because the ventricles are contracting inwardly. So when it contracts inwardly, the tension on these chordae tendineae loosens, so that will close down these valves. And when it closes down these valves, and when the ventricle contracts, so the blood cannot go back into the atria again because the valve have been closed, and this is the job of the valve, to prevent the backflow of the blood from the right ventricle into the right atria. So this is the importance of attachment of the cusp with the papillary muscles that helps to close down the valves when the ventricle contracts. Now in the right ventricle, we also have the muscles which are known as the trabecular cardiac muscles, which are the ridges of the cardiac muscles present inferiorly in the right ventricle, and these papillary muscles are also the type of the trabecular cardiac muscles. So the difference between the trabecular cardiac and the papillary muscles is that only those trabecular cardiac muscles are known as the papillary muscles to which the cusps of the valves are attached. So this is the ventricle, and these are the trabecular cardiac muscles. These are the ridges of the cardiac muscles, and only these trabecular cardiac are being called as the papillary muscles because to these the cusps are being attached with the chordae tendineae. So these are the papillary muscles, and these are the trabecular cardiac. Also, there is an area which is present at the junction of the right ventricle and the pulmonary trunk. That area is known as the infundibulum, also known as the conus arteriosus. That red color area, that is known as the, we have highlighted that area with the red color, that area is known as the infundibulum or the conus arteriosus. And this is the area which is the entrance from the right ventricle into the pulmonary trunk, because this is the right ventricle, and after that this is the pulmonary trunk. So this is the area which divides the right ventricle into the pulmonary trunk, right? So this is the infundibulum or the conus arteriosus, which is present at the junction of the right ventricle and the pulmonary trunk. So in the right ventricle, what we have discussed so far, we have the tricuspid valve which has three cusps and which are attached to the papillary muscles by the chordae tendineae. Also we have the conus arteriosus, which is the area at the junction of the right ventricle and the pulmonary trunk. So the blood from the right atria goes into the right ventricle, and from the right ventricle it goes into the pulmonary trunk and the pulmonary arteries into the lungs, where the gas exchange take place and the blood becomes oxygenated, and this oxygenated blood then comes into the left atria by these pulmonary veins. And the left atria doesn't have much features as compared to the right atria, and the left atrium has a very smooth surface, and it doesn't contain the pectinate muscles, whereas the left auricle do contain the pectinate muscles. And then the blood from the left atria goes into the left ventricle by a valve which is known as the mitral valve or the bicuspid valve, because it contains two cusps. So the blood from the left atria comes into the left ventricle, and the left ventricle have the same features, somewhat same features as compared to the right ventricle. The left ventricle do contain the trabecular cardiac muscles, and in the left ventricle, uh, the, the bicuspid valve, is attached with the papillary muscles, and you know that the left atria is the major pumping organ, and when the left ventricle contracts, it propels the blood out of the heart into the systemic circulation. So we have four major valves which are present in the heart, and the job of the valve is to prevent the backflow of the blood. So in between the right atria and the right ventricle, we have a valve which is known as a tricuspid valve. So the blood from the right atria goes into the right ventricle by this tricuspid valve, and then the blood comes into the right ventricle, and the right ventricle contracts, and the blood from the right ventricle goes into the pulmonary trunk. And at the base of the pulmonary trunk, we have another valve which is known as the pulmonary valve, also known as the pulmonary semilunar valve, which is there to prevent the backflow of the blood from the pulmonary trunk back into the right ventricle. And then the blood from the pulmonary trunk goes into the pulmonary arteries and to the lungs, where the oxygenated blood comes back into the left atria, and at the junction of the left atria and the left ventricle, we have another valve which is known as the bicuspid valve, also known as a mitral valve. And then the blood from the left atria goes into the left ventricle, and when the left ventricle contracts, it propels the blood from the left ventricle into the aorta, and at the base of the aorta we have another valve which is known as the aortic valve, also known as the aortic semilunar valve, which is there to prevent the uh, backflow of the blood from the aorta back into the left ventricle. So we have the tricuspid valve, we have the bicuspid valve, and we have the aortic valve and the pulmonary valve. The aortic valve and the pulmonary valves are also known as the semilunar valve, whereas the mitral valve is also known as the bicuspid valve. Now let's talk about the cardiac conduction system. The cardiac conduction system is the special system in the heart which allows the heart to beat on its own, and this system is made up of the special cardiac muscles and the fibers, and this allows the heart to maintain the automaticity. So the cardiac conduction system has different components. We have in the cardiac conduction system we have the SA node, AV node, the AV bundle with its right and the left bundle branch, and the Purkinje fibers. Now we will try to understand these different components. So in the normal healthy person, in the healthy heart, the general rule is first the atria contract and then the ventricle contracts. So both the atria, the left and the right atria, they contract simultaneously, and after the atria completes its contraction and undergo the relaxation, then the ventricle contracts. And that timing which at which the first the atria are contracting and after that the ventricles are contracting, that timing is maintained by this cardiac conduction system, by the SA node and by the AV node. So in the cardiac conduction system we have the SA node, we have the AV node. The SA node is present at the junction of the superior vena cava and the right atria, and we have the AV node which is present at the atrioventricular septum, and from the AV node a bundle branch comes out that is known as the bundle of His, and this bundle of His then divides into two branches, one into the left bundle branch and the other one into the right bundle branch. So the right bundle branch then moves into the right ventricle in the interventricular septum, and it comes into the base of these papillary muscles, and then it further divides into small fibers which are known as the Purkinje fibers. And the left bundle branch continues on the left side of the heart in the interventricular septum, and It also goes into the papillary muscles and further divided into the small fibers which are known as the Purkinje fibers. So this whole SA node, AV node, the bundle of phase and the right and the left bundle branch and the Purkinje fibers, they all make the cardiac conduction system. Now I would like to tell you about some important points related to the SA node. The SA node is made up of special cardiac muscles. Now in the heart, we have two different type of muscles. One are the normal cardiac muscles which make up the myocardium, which help in the contraction. And these SA node and the AV node, they are made up of special cardiac muscles. Now what is important about the SA node is that the SA node has the power of the automaticity. What is meant by automaticity is कि अगर आप हार्ट को जितनी भी नर्व फाइबर्स जो सप्लाई हो रही हैं, अगर आप इन नर्व फाइबर को कट डाउन कर दें, तब भी हार्ट बीट करेगा, तब भी हार्ट कॉन्ट्रैक्ट करेगा, just because of this SA node. Because the SA node has been given the power of the automaticity by the nature, and because it is made of special cardiac muscles, so therefore it maintains the pace of the heart. Also, SA node undergo rapid depolarization. When the impulse reaches to the SA node, it undergoes rapid depolarization because of these special cardiac muscles which made up the SA node. And when the impulse comes to the SA node, it is because of SA node, the atria contracts, and then the SA node transfers that impulse to the AV node, and because of that AV node, both the ventricles contract. So the SA node sets the pace of the heart, and it is the natural pacemaker of the heart. So in the cardiac conduction system, the impulse begins at the SA node, and this allows the atria, both the left and the right atria, to contract simultaneously, and the wave of the excitation in the atria then stimulate this AV node, and the AV node then delay that stimulus for a brief period of time, just to not allow the ventricles to contract with the atria, because the ventricles contract after the atria complete their contraction. So the stimulus from the AV node travel to this bundle of his, and to the right and the left bundle branch, and to these Purkinje fibers. And because of that unique distribution, the ventricles contract simultaneously and quickly. So this is the unique distribution of the cardiac conduction system, and that unique distribution of the cardiac conduction system allows the heart to maintain its rhythm and contraction. Thank you very much.